So operations really are regularly scheduled activities that are required to keep the infrastructure running. A lot of hospitals might have their own water pump. So, turning the water pump on and off, filling up the chlorinator that disinfects the water. Something that you're going to see in really all the levels is, filling up soap, replacing paper towels. The next thing we have is preventive maintenance. So this is regularly scheduled maintenance activities that help prevent unexpected failures in the future. This can involve testing and monitoring things like water quality, measuring voltage or other pump performance parameters, cleaning, keeping pipes or mechanisms or tanks, filters clean, and then changing things like filter cartridges that need regular replacement. And then finally, we have corrective maintenance. So this is what we do once a piece of equipment has failed. This doesn't necessarily mean that it's unexpected. We can, and one of the things that we need to do when we're planning is we need to understand more or less how often we can expect these things to fail. Gaskets, seals, pipes, they're all going to cause leaks. A pump maybe is going to last 10 years. And something that doesn't necessarily get considered a lot is something simple like floor tiles. It doesn't seem like wash, but really having broken floor tiles is one of the most common things that we see that can really affect the hygiene of a facility. Those broken floor tiles really provide a place for the contamination to gather and infections to gather.
So without operation and maintenance, all of our infrastructure would eventually stop working. However, new construction is often prioritized over operations and maintenance. People often don't see operations and maintenance, but it's, if you have a bridge and you repair it, nobody sees that. But if the bridge falls in disrepair and you have to build a new one, people see that, people notice.
Efforts will become more deliberate when wash is part of the felt need of the health workers. Seeing people and having a broken water system, and then the monitoring team comes and finding there's no water, or finding will result to me not scoring high, and so not having all the money that I should have got, makes it a shared responsibility, actually makes it top on agenda because it's a key contributor to all the other aspects. Then also wash systems that are appealing and make work easier for the health workers are most likely going to be catered for. We've seen this, where health workers have to carry hand washing facilities every morning, bring them out, fill them with water, carry this. It's not uncommon to find these hand washing facilities empty. But where you've put a hand washing facility like pedestrian operated, knee operated, where they are appealing, they're taken care of. So this goes back to thinking about operation and maintenance right at the point of designing the system. If you give me a bad design, I will not love it, and the chances of me not taking care of this system are going to be so high. And then also governance has played a big role in this, in making sure there's a plan, there's budget, and also funds allocated.
We need to include planning from the start, whether that's a new facility where in that case planning is maybe a little bit simpler, or most cases are repairs or upgrades. So they might be expansions, they might be repairs of things that aren't working, they might be putting in more modern equipment. So the first thing that we need to do is start with an analysis of how things got where they are. Why did the infrastructure fail? Was it poor quality equipment? Has the facility grown beyond the capacity of the equipment? Is it just age, wear over time? Was there some sort of barrier to maintenance? You need to ask all these questions and work with all the stakeholders to develop a plan for how to avoid repeating this, and also a commitment to follow through on that plan. And I think you're going to find your own complexities wherever you work. You need to really identify what are those stakeholders and involve them all in this analysis and in the planning of the O&M for the improved technology or infrastructure that we're going to leave in place.
So we talk about personnel, we're talking about human resources, roles and responsibilities. So who on the staff is responsible for various O&M activities? And is there a dedicated O&M staff or team? Probably going to vary based on the facility size and really what the capacity is of the staff within that. You may have nurses and doctors who are also acting as human resources for O&M, and you may have dedicated O&M staff, depending. Skill building, how are the skills to perform O&M developed? There are soft skills and hard skills, so both are valuable. Are there opportunities to develop that either at the facility or through other resources? Communication and engagement, what system is in place to communicate O&M needs and budgets, and even communication between the director and the maintenance staff. And then lastly, outsourcing, what activities might be outsourced, whether that's preventative or corrective. And then the question is, where does that outsourcing come from? Is that contracting a cleaning service in the community, or do you have to source somewhere further?
Yeah, these are the costing components that must be considered for ensuring sustained wash services. There are 6 elements here. The first is the initial capital expenditure. The second is costing for operation and maintenance, called OPEX. That also covers regular minor repair cost. The third is rehab and renewal cost. The fourth is cost of capital, such as interest on loans. And the fifth and the sixth cover direct and indirect support cost. Costs such as for monitoring, policy development, planning, capacity development, regulation, etc. Here we are showing calculation of annual repair cost and functionality. Functionality is expressed as fraction or percent of the expected time the facilities are functional. In addition to the breakdown frequency is breakdowns in a year. Functionality is related to time needed to address the breakdown, and the yearly repair cost is related to the cost of each repair. And finally, this is a new element we are working on while developing costing framework within operation and maintenance policy development. We realize the relevance of linking functionality with coverage and usage. We hope this exercise will help us in developing more realistic policy in which the performance can be monitored and enhanced using coverage and usage along with functionality and the associated costs.
Making WASH a key pivot to performance that is tagged to funding will ultimately result into the duty bearers paying attention to the functionality and operation of these WASH in healthcare facility systems.